All right, everybody, let's get started. So, today we're going to look at our next group, which is older Americans, our third kind of group in the various life stages that we've been looking at. So, in the same way that we looked at adolescence and then adulthood, and how both of these have kind of changed in some cases like numerical age and how we define them in the United States, but in a lot of other cases in terms of like life stages and kind of cultural changes associated with each group. We're going to do the same thing now, and some of this will overlap with the documentary, and some of this will introduce some newer concepts too. So let's get into this a little bit. So when we look at the elderly in the United States or senior citizens in the United States, I like to start with this question, and obviously we can't necessarily talk about it in the same context as we would if we could discuss in class. But when you look at the challenges faced by senior citizens, and some of you guys had brought some of these things up in your reflections from the documentary, there's a lot of things kind of rooted in medical concerns, right? The older you get, the more your medical costs tend to be, the more complex some of your medical issues tend to be. So we tend to look at that as well as things like retirement, having enough money or financial stability to survive after finishing work. But in addition, there's also some issues that are not necessarily purely economic. For example, isolation is one of the biggest, social isolation, as well as not just social isolation, but even a lack of ability to advocate for yourself, depending on some of your physical issues. So these are all some of the things that we'll look at in a little more depth now. So I know this seems kind of primitive, but at least historically in the United States, and some of this has changed, or is changing, I should say. But historically in the United States, when you look at life over 65, and 65 tends to be the dividing line when we talk about senior citizens, just because legally with things like Social Security, 65 is the number that comes up. As silly as it sounds, you often see the elderly being divided into what are called the young old, the middle old, and the old old. Someone should probably work on those terms, right? But I show you the divisions based on age. It's basically 10-year gaps and then 85 and up. It's not based on your outlook on life. It's not based on social connections. A lot of this is based on medical conditions. And at least statistically speaking, scientists have been able to essentially show that these 10-year gaps can be, or 10-year blocks can be divided because as you work from one to the next, the severity and complexity of the most common types of medical conditions, as well as the increasing difficulty in treating them, tend to increase. So, comparing this to some of the other things we looked at. In adolescence, we talked about major milestones. With men and women as adults, we talked about life events, family-based events, things like that. Well, age for people over 65, in a lot of ways, unfortunately, tends to be defined, at least in part, by some of these medical conditions. So I showed you this graph on the prior lecture, or this map rather, looking at the age of the United States and the median age. However, this is not necessarily going to accurately portray the increase in people who are over 65. This is just kind of the overall age of the country. So if we look, and we look at the age of the United States, or the age or the quantity of people who are over 65, we see a dramatic increase over the last 100 years, where at the turn of the 20th century, you had less than 15 million people over the age of 65. And by 2010, you had well over 40 million people over the age of 65, and that number continues to rise. And a lot of it is because of medical changes and the improvement in medical care. But there are some other things too. So if we look at my cursor, you see right here at 1930, the increase starts to go up, right? So from 1930 to 1960, a lot of that increase can be connected to Social Security. Social Security is passed in the mid 30s, and as senior citizens become more financially stable, it allows them to spend more money on things like medical care, improves their quality of life, and as a result, longevity goes up. Then, if you look, we see right around here, we see another change and a slightly more accelerated uptick. This is where Medicare and Medicaid were passed. So now you have guaranteed health insurance for people over 65 with Medicare, and longevity increases as well. So a lot of this has to do with some of these government plans and government-sponsored insurance plans that dramatically improve quality of life, thus also improving longevity. Now, if we look at this, this gives us a different kind of projection. So in 2020, right, we have about 60 million people. You see this dramatic bump. This is the baby boomers, all right? And by 2050, we're going to have, we think, close to 100 million people over the age of 65, and also close to 20 million people over the age of 85. And both of these have to do with the improved, like I said, economic conditions, medical conditions. But when you start talking about a population that has this large a proportion over the age of 65 and then 85, it's going to dramatically change some of the major issues that need to be dealt with. And what it does is it brings up a lot of these medical issues primarily. It's not just the United States, though. If we look, the percentage of the population age 65 and over in 2015 and 2050, obviously 2050 is a projection, we see that the entire world is getting older. The United States actually, in an odd way, is getting older at a slower rate. If you look like in Latin America, in Asia, you see these jumps of not just like one block. You see how like each color is an individual step, but you see two-step jumps. So, the issues that the United States is going to be dealing with are not necessarily unique. And it's in some ways the fact that we are, excuse me, we're kind of victims of our own success. We've made tremendous strides with medical care and with economic advancement, not just in the US, but in the world, relatively speaking. And as a result, people are living longer. But what that does is that now creates bigger challenges and more challenges in terms of now taking care of this population that never really was this big before, so you didn't need as many resources. So kind of getting into some of the more specific things that people deal with. For older Americans, at least, we know that retirement is kind of the big life milestone in this age bracket, right? And that can create some psychological stressors. We then see physical and mental deterioration. This is the medical component that we talked about. And, you guys saw in the documentary, things like dementia have become increasingly problematic. This can then lead to dependency on your children, your grandchildren, others, which can also lead to psychological issues. And then ultimately, the kind of coming to terms with like our own mortality. I know this is kind of a dark conversation, but it's true. Psychologists, sociologists have all kind of pointed to the idea that one of the biggest psychological challenges and kind of well-being challenges for the elderly is coming to terms with the fact that they have lived the majority of the life that they are going to live at this point. And I mean, if you think about that, you could certainly understand why that would be a tremendous psychological challenge to kind of come to terms with. Now, going back a little more specifically to some of the medical issues, this really links directly with some of the things that you guys saw in the documentary, which is why I wanted to talk about it a little more. So this is the projection for Alzheimer's, but also for dementia as a whole. And as you see, by 2050, we think we're going to have about 100 million people in the world with Alzheimer's. And today, we estimate it's about 41 million. So in 30 years, it's going to more than double. Um, and you say, well, what happened? Why are these numbers going up so quickly? Some of it is probably us being able to detect it more. In earlier times, it was fair to say that people weren't aware of what Alzheimer's was. So I think a lot of people were not diagnosed initially. But in addition to that, we have another issue. And this kind of goes back to what I said about being victims of our own success. As human beings live longer, our parts wear out, so to speak, to, use like the car metaphor. Eventually, you got to change the transmission. And obviously, when you're talking about anything psychological, anything related to, memory, like that's not something you can fix, right? You can get a heart transplant, you can get a hip transplant. We can replace or repair most of the physical issues that we have. We cannot do that when it comes to things related to our brain. And as a result, partially because people are living longer, a lot of these issues that were not necessarily prevalent because people just didn't live long enough to develop them in these higher percentages. Now that we are living that long, things like Alzheimer's are becoming growing problems. And kind of coupled with that, you see with assisted living the same type of thing. So assisted living facilities were not really on the radar for a very long time because we just simply didn't have that many people who they would have been useful for. But as our population gets older and as more and more people live longer and longer, these become more significant. So this cost, by the way, is monthly. All right. So that's, $2,000, $3,000, $4,000, or even $5,000 a month. And so we see this tremendous financial strain, and this is just regular assisted living facilities. This does not necessarily include like all those memory care units. That's much more expensive. So we have this tension now in our society where more and more people are requiring more and more expensive care for longer periods of time, and our system's not really set up for it yet. There's that whole school of medicine, gerontology, where we need basically more doctors and more research for these advanced age type medical conditions because, it's not that we didn't need it before, but the need has become far more pressing in the last 10 to 15 years. And as you see, one of the, I talked about isolation issues. One of the things that comes up for the elderly in particular is that as people lose spouses, as people's children move away, isolation becomes an issue. So you see here living situation of community-based seniors. When we look at this, in many cases, all of these various factors, but if you look at the all, so this is just, all kind of seniors, about 1 in 3 is in some sort of kind of single occupancy residency. So basically 1 out of 3 seniors risks, complete social isolation or significant social isolation. And this is a problem because one of the things related to Alzheimer's and to dementia that we know, and while it's more anecdotal evidence, we're pretty sure that it at least has some degree of influence, is that as soon as you stop interacting with people frequently, it accelerates the process or it accelerates the disease. And we also know that it makes you far more likely to be susceptible to it if you are not suffering from it yet, if you begin to be isolated. So, that mental stimulation is crucial. And if, a third of people who are vulnerable to this are isolated, obviously that's something that needs to be addressed. So one of the ways that it is addressed actually in society is people are, now that they're living longer, are also working longer. So you see here, this is a shift, in the 20-year span from 94 to 2024, all right, which is really the workforce that you guys are going to be entering if you think about it. People over the age of 55 went from only being about 12% of the workforce to now being 25% of the workforce. And I think in particular, something should stand out here for you. So you see that the 25 to 34 and 35 to 44 folks. So, you guys are going to be hitting that 25 to 34 when you get out of school. You were the biggest workforce. And the group I'm in, just in front of you, kind of combined, we're the two biggest workforce populations in America in 1994. And now, if you look, people over 55 have become the biggest part of the workforce. And people in the 45 to 55 range are growing rapidly too. So, what this leads to is economic consequences in the country that relate to people other than seniors. This is one of the reasons why it's become increasingly difficult to get a job, is because people are working longer. And you're not going to fire people, but it does raise the issue of, well, where do all these new jobs have to come from now that everybody's staying in the workforce longer? So if you look here, it's not just that 55 plus community. If you look, we see a huge increase in people even in the mid to late stages of that old age kind of comparison, where we've had a 172% increase in people over the age of 75 working. The people 70 to 74 is basically doubled, a 100% increase. 65 to 69 has almost doubled. So we see this huge increase in the number of people who in the past would have retired, continuing to work, at least in part to stay connected, to kind of address that isolation issue. But again, if more of them are working, and there are more of them overall because people are living longer, that does mean that there are now less jobs for the people coming into the workforce. So this kind of exacerbates some of these tensions. And as you see, the retirement age is starting to rise a little bit. In some places, people are still retiring a little earlier in their early 60s. But we're starting to see more and more that retirement ages are going up, and people are pushing off retirement until after 65, even though they qualify for Social Security. And if you look at the next slide, you can probably see why. Because when we look at the average cost of healthcare per person per year in the United States, right around the time that you hit 60, and then obviously 65 to 70. Whoops, sorry about that. The healthcare costs go up dramatically compared to the rest of the world. Not that they don't go up for the rest of the world, but in the United States, our costs are accelerating at a rate of 4 to 5 times as quickly. So if you have to spend that much more money, you could see why people would potentially continue to work for their benefits in order to pay for them to have a higher quality of life. Now, when we look at this in a societal sense, there are a variety of kind of bigger social issues. The media and its kind of portrayal of the elderly has been brought under fire, and we're actually going to do kind of a small project with this going forward. A lot of this also centers on the baby boomers. I mean, you guys all know the "Okay Boomer" meme, right? Let's face it, there is some tension between that older group and the younger group in America, and some misconceptions that I think, in all fairness, the baby boomer generation has about like you guys, but in all fairness, also I think some misconceptions in the younger generation about the boomer generation. But a lot of this tension also is related to this idea of the graying of America, where we are getting significantly older as a population. And with those rising medical costs, for the first time in a very long time in American history, we're starting to see some poverty problems with the elderly again. That was not the case after Social Security and Medicare for a while, but costs have gone up to the point that this is becoming a bigger deal. So this is what I'm talking about. If you look at poverty, since Medicare was passed, we see that there's been a tremendous drop in the poverty rate, right? So people over 65, almost half were in poverty in the mid 60s, and now we've dropped to the 15% mark. But if you look, there is the beginnings of a slight increase here again. It's small, and we can probably address it, but it is the first time that we've seen that in a very long time in American history. And what we see is that, unfortunately, this also disproportionately hits minorities. Elderly Black, Hispanic, and Asian Americans are suffering from poverty at a significantly higher rate than elderly white Americans. Now, obviously, this goes beyond the elderly. We haven't gotten into race yet. We've only touched on it and gender issues. We will obviously get into them in more depth. But the point of this is just that a lot of these issues are what are called intersectional. They overlap, and they are not just purely based on one thing. Okay, so that's all I wanted to do today was just give us a little bit of an intro, and hopefully this helps provide you with a little bit of context from the documentary. And going forward, what we're now going to start doing is a little bit of work, kind of looking at all the age groups and how they are perceived, and how they kind of perceive each other to try to get a better understanding of why there are some of these tensions. So that's that. I will talk to you soon, and have a good rest of your afternoon, guys.